work that I loved was an accident of fortune. You see, my second son was born and he had every possible allergic disease. He had eczema, he had food allergy, he had asthma, and he developed hay fever. And nobody knew about anything in the allergy world. I went looking. I went to back to Johannesburg. I spoke to the guys who were, so to speak, involved in allergy, and the advice they gave me was absolutely of no value. So I started to think about allergy. I'm Gloria Davis, that's my maiden name. I was asked by the university when I was getting married to remain with my maiden name, which they said would be easier. It hasn't been, because all my official documents, my ID, my passport, are in my married name, and I've actually been stopped from getting on an aeroplane when I've been going to conference. Anyway, I was 17 years old, and the question has often been asked of me, why did I do medicine? I hadn't given it much thought. I knew what I didn't want to do. I didn't want to do the arts, I didn't want to do accountancy, I didn't want to do any other form of science. So I started to hone in on doing medicine, and my dad, who was a pharmacist, thought it was a great idea for me to do it. And I felt I could do it, although at school we had a vocational guidance teacher, and there were 4 of us who were going to apply for medicine. And she turned around to me and she said, I don't think you're going to do it. And I never said anything, but I'll tell you what I wanted to say to her when I qualified. I went to university and it was a bit lonely. I was friendly with one of the girls, but it was huge classes and no chance to really socialize, although we started to have parties and I played sport with a school friend of mine. That was first year. And of course then we left the university and we went up to the medical school on the hill. And honestly, there wasn't much time for anything else. We started at 8 in the morning and we finished at 5 in the afternoon, except for Wednesday afternoon. And we worked on Saturday mornings as well. And there were, in a class of about 120, 10 girls. And we were singled out. It was like almost a joke that we were there. Even in the dissection halls, we would be picked out if we laughed or if we found something funny. In April that year, we had the RAG. I don't know if you remember RAG. And we'd drive through the city centre and people would throw coins at us. Almost like what they have in South America and in USA. And it was great fun. When we got to the clinical years, that's when they made us feel that we were women and not men. We were told how to dress. We were only allowed to wear dresses. I wasn't allowed to wear heels on my shoes. We had to wear very clean white coats. Our hair had to be neat. Everything was frowned upon that was not very conservative. And the specialists also made us feel small. There were some of them. Others, one felt you were the same as the guys. But underneath it all, I just felt that I had to keep proving that I could do the work as well as they could. And then in 1958, we all qualified. And I'm blowing my own trumpet, but I did well. And I thought I'd haul out the book I was given by the University Women's Society, Johannesburg branch. They gave me a book as a prize. I think it was worth £2, 10 shillings or something in those days. And I've got it there inscribed with the certificate. And to be given the best woman graduate prize. It was a feather in my cap, and all I could think of was, I wish I could go and show it to the vocational guidance teacher. How easily and how comfortably I managed this very concentrated education pathway. So then I was already married, and in fact I was already pregnant at the age of 22. And my husband wanted to return to his hometown, which was Uitenhage. And I had no say in the matter, because that's what it was in those days. You did what the men told you to do. You did what your mom told you to do, because my mom was very conservative. And my mom, due to her difficult childhood and her arrival as a refugee in South Africa, prized family above everything else. So I went to Uitenhage to do my housemanship in between having my baby and the next one. There were no specialists. They would come once a week to the Uitenhage hospital. I must say the staff were great, but it was very difficult being a houseman without much supervision. And I was very happy when it was over and I could start doing work that I loved. Just after my daughter was born, I heard about a doctor in Kimberley who had helped a friend's baby. So I went to see him, and we saw the big hole, and he told me that he had been living in Cape Town and he retired to Kimberley. And when he got there, he realized he was seeing no asthmatic patients. And that was my introduction to the environment and the incidence of asthma. And I'd also noticed that when we drove up to Johannesburg, he literally improved on the way up. And so I began to be interested in it and to study allergy and how to test for it and how to treat it. And then it was lonely because I really had no one else to talk to about it. But I then was told about Dr. Eugene Weinberg in Cape Town, who was a young registrar and who was running an asthma clinic, allergy clinic. So I went down and we met, and it was an absolute joy to be able to speak to somebody who was as interested as I was in allergy. And we became good friends, and it was lovely to be able to chat to him and to keep up with all the new drugs that were coming out for asthma. I could regale you with laughter about how people gave me advice for my son, which was ridiculous when we think about it now, but at that stage you could try everything and anything you wanted because you were so desperate to see your child get better. I met my husband-to-be when I was in second year. He was also a medical student at that time, and he taught in one of the histology classes. In 1981, my husband informed me that he was giving up practice and we were going to live in Johannesburg again because it was my time. So I managed to get a post at what was the J.G. Stradum Hospital in those days with Mike Plitt, who was running the asthma pulmonology unit there, and which had a fantastic reputation. And it was a great time for me. I was in academia again. We were doing trials. I was seeing asthmatic patients. But all the way along, I kept saying to them, why are we not looking at allergy more seriously? I guess we were just busy and no one was interested enough to do it. At the same time, I got involved in teaching anesthetists. Well, they weren't anesthetists yet. I loved teaching. I began to realize when I was there that it was the second love of my life, patients first and then teaching. And Professor Lipman, who was head of the ICU, arranged that all anesthetic registrars would be sent to examine patients, and then a meeting would be held on Friday afternoon with everybody who had any interest in surgery, whether it was the surgeons themselves or the physicians or the radiologists or the physiotherapists. We all met, and the registrars had to present the case and say how they would give an anesthetic. And it became a wonderful exercise. And I used to go from registrar to registrar and go over their examination, because, you know, they had forgotten a lot of their clinical work. Anyway, 1989 arrived, and we had been slipping in doctors from the other hospitals, the coloured hospitals, to come and work with us. And the management got to hear about it, and we were told in no uncertain terms that no black doctors could work in the hospital. It was whites only. And with that, Wits withdrew from the hospital, and all of us resigned. We weren't prepared to be told that again. So I had to decide where to go, and Jeff talked me into going to Barra, mainly to carry on with the work of the anaesthetic teaching. But I approached the medicine department then, and they said I was welcome to join them in their asthma unit. So I thought that would be great. But coming to Baragwanath from this well-organized, well-run hospital, I'm not talking about nurses or management, I'm talking about the actual work that was being done. It was a shock. We had to examine patients in this tiny outpatient unit. There was no way they could change. We couldn't examine them. Their files were disorganized. And I started to go around the hospital looking at the number of asthmatics who were readmitted. And in the previous job, if your patient was admitted, it meant you'd failed your patient. And these patients were coming in every few months. And I gave a lecture to the medicine department that none of the patients knew how to actually use their treatment. So I begged and borrowed from, well, we had been given some money by one of the drug companies to form a respiratory unit, but I felt it was too much responsibility for me. But I asked them to lend us some of the money, and we established a unit where the technologists could work, where we could see the patients in much greater comfort. And I felt it was successful. I left the department and I was leaving the hospital, and Jeff said to me, "No, you're not doing that. We'll find a job for you, and you can do whatever else you want other than arranging teaching for all the anaesthetic students and the anaesthetists." I was doing more for them. And I approached the pediatric asthma unit, and that is where my research began, because they had never done allergy tests on the children. And there were very few studies, almost none, on were black children allergic, because we were seeing so many asthmatics and eczemas and hay fevers. And so I begged and cajoled the management to get me a set of prick tests, and we started to do every single child. And also David Late, who'd returned from England and became head of the unit, after I'd begged the staff there, I mean, it was busy, but to please let us use folders that we could analyze in the computer. So David came, and together we designed a 10-page file, amongst which were the skin prick test results. And to our amazement, a great many of the children were allergic, something that had been denied. And to our amazement, 50% of them were allergic to what is called house dust mite, which was not supposed to be found in Johannesburg, because these little creatures love a humid climate. So house dust mite had been discovered by work in Switzerland, where they took asthmatics up to the top of the Alps, and they were much better there. The humidity was so dry there, the children got better just living there. And yet these children, we found, were allergic to mite. So if we didn't have any in Johannesburg, where were they being sensitized from? So as part of my study, I had a sister go into the homes of these children in Soweto, and we looked for mites, and they weren't many, but they were there. And obviously the children had become sensitized. Yet when we did a family history on them, none of the parents had allergic disease, except 2 of the mothers. They had asthma, and they were born in the rural areas. They weren't born in the rural areas. All the mothers who were born in rural areas, despite carrying the genes for allergy, had never developed asthma themselves. But these 2 were born in Soweto. And many studies have now shown that living in an urban environment is a risk factor for the development of allergic disease. So we did that work, and I must say we presented it, David and I, we did it together, we presented it all over the world, and many, many studies followed. But you know, apropos being a woman, all this was my idea, all this was the love of my life, allergy. And yet when we were awarded a bursary for the research, it was given to David. And David was absolutely shocked. He said, "It's not my study. I, yes, am involved in the statistics and the writing of the articles. We did it together. But even then, praise was given to the man, and I was ignored. It was really hard for that. Anyway, at that stage, all the great asthma drugs, all the great antihistamines, all the wonderful cortisone sprays came out, and there was a revolution in the treatment of asthma. And yet, I had to lecture over and over again about why are the doctors not using our guidelines? Why are they not doing what we tell them to do? Take a history. Because you know, when I have finished a history on a patient, I've already bet with myself whether it is an allergic problem or not. The Allergy Society was formed in 1987. That was a great step forward, because up until then we had to combine with the pulmonology specialists. And there was no ways I could specialize, because I didn't want to become a physician. I wanted to become an allergist. And in 2004, the first exam was offered for a diploma in allergology, it was called. And there were about 8 of us, and we all did it, and it was with great joy that I could then claim that I had a speciality that I was doing. So I did very little general practice, and I based most of my work on allergy. And the lecturing and the joy at attending conferences and was immense for me. course, looking at all the other doctors around me, they were the same age as my children, if not younger. In fact, when I wrote the exam, I sat in the hall and I looked around and I said, good God, some of these could probably be my grandchildren. But it was lovely. And then I was awarded a certificate by the Allergy Society for my work in allergy, which was a great pleasure for me to be recognized by your peer group. And in 1915, at a conference in Port Elizabeth, to which I'd never returned until then, to find great change, but they made me an honorary member of the Allergy Society. So I have been thanked for my contribution, but I still think that my joy is in patients and making them better, and in teaching. I think that's what I actually do when I'm with them. I treat every patient as if they understand what I'm saying. And then I finish off and say, don't worry, you don't have to remember this all. Just remember there's a good basis for your complaints. I was asked to give a speech on speech night at my old school, Parktown Girls. And I told them about my research work, and I said to them, if I can give you any message, if you want something and you believe in yourself, go for it. Don't let anyone ever tell you that you can't get there. Because of pressure in my day as to what a woman's life was, I got married when I was a youngster. I'd never been overseas. I knew nothing about life. And my instructions from my family were, you must be a good daughter, wife, mother, niece, first, before anything else. Nowadays, women are respected for their decisions, and they can do all that, but first they qualify. First they specialize. And then, because instincts are instincts and you want to be a mother and be happily married, they do that afterwards. And then they continue with their careers. But with me, I had to juggle both together. And hence, I think people thought that being a doctor was really a joke for me, because I was well known as a cook and an entertainer, but it was a sacrifice for me to have done that. I had wanted doctoring to become the first thing in my life. But as my kids say to me, are you sorry that you had us? I said, no, you're still my greatest gifts, and my grandchildren.